My name is Michael Glazier. I'm a pediatrician. I've been practicing for 20 plus years. I often get asked what led me to a career in pediatrics, and really the answer to that is what led me to a career in medicine. And there's probably three tenets that I hold dear to myself that led me this direction. One is kind of intellectual curiosity. I love to learn. I wanted to go into a profession where you always have to learn, and medicine is constantly evolving, so checks that. The other is, I've always been curious about the human condition. So psychology major in college. What led me to medical school was wanting to understand how people work, what makes them tick, how they respond to things. Chose pediatrics because we do so much behavioral health in pediatrics. It's a privilege to be a pediatrician because we get to know not just the child in front of us, but the family as well. I mean, let's face it, kids are awesome. They're incredibly resilient, they offer such a glimpse of the future, and their attitude and approach to things is they're wide-eyed, they want to learn everything, and to be honest, somewhat selfishly, it's invigorating. You surround yourself with people like that, with kids like that, and it makes you kind of want to be that way. And so I think it's their overall approach to the world, kind of carte blanche, untainted, is incredible. So the question of how to make the doctor's office comfortable for kids starts with the realization for the parents, the pediatrician, and the child that the child is the patient. From a psychological perspective, when I walk into a room, there's generally four parties present. There's the child who's the patient, and then there's the family, and then there's myself as the pediatrician, and then kind of behind the scenes is myself as that age child. You can't divorce yourself from it. It's kind of there, and either you're conscious or you're subconscious. And to make the visit fun, I think for all ages is, one, to get down on the eye level of however old the patient is. And I think it is super important to gain the trust. Particularly we love longitudinal relationships. And if we start developing that trust when kids are in elementary or middle school, then those difficult conversations they might want to have with an adult that's not a parent are much easier. Two things that I think are incredibly important to parenting and to children today. One is, good nutrition. Kind of centering around eating wholesome foods. Anything that we can get from plants and animals is much more beneficial than something that you might get out of a vitamin or supplement. The other bit of advice I give is that our kids are now growing up in this incredible era of social media where they are spending so much time in front of their phone, in front of their laptop, in front of the television. And my advice there is, one, try and delay that as long as possible because it doesn't really promote divergent or creative thinking. It is okay for kids to be bored because when they're bored, they tend to do the most, introspective thinking and come up with the most connections. The other thing is spend time outside with your kids and encourage your kids to spend time outside. There's also a tremendous emotional aspect to it as well. So the advice is pay attention to what your kids eat and spend as much time outside, close to greenery and nature, and try and limit the social media and technology as much as you can.